It's unfortunate.
I hear our second guest. Unfortunately, we need to quickly cut your line of thought. Our second guest, Nseabasi, Dr. Nseabasi Ekanem, who is a public health expert and national coordinator, Civil Society Network on Hepatitis, just joined us. Good morning. Thank you for joining us. We've been speaking about this development by the federal government, talking about bringing in 18 billion naira to address the wrath, if we might want to put that, in the medical sector, to also encourage students to be a part of it. 18 billion for 18 institutions that are teaching issues bordering on medicine and all of it. What do you make of this step being taken by the government?
Thank you very much, first of all, for having me. Brain drain is something that is quite worrisome. And so any effort taken by the government towards curbing the menace of brain drain is something that is quite laudable. And I must say that when I read the news, I mean, I could relate because Dr. Tunja Lausa is one person that those of us in the healthcare system in Nigeria really love a lot. And so this effort is something that is highly in demand right now. Given the fact that we are losing doctors in droves, and not just doctors, healthcare professionals in entirety. I mean, every year you see thousands of healthcare professionals, write to the council to get letter of good standing, of course, which is the letter that we as healthcare professionals get from the council so that we can move over to other places to work or to study. And so when you look at that and vis-a-vis the number of students or number of graduates that are churned out every year, you begin to see that it presents a very dire situation. So this investment by the government, to burgeon medical education is something that is quite heartwarming. And we are hoping that over the next 5 years, we'll begin to see 5 or to 10 years, because of course it takes an average of 6, in some cases 7 years for medical students to graduate from universities. That would also help to bridge that gap. But I think beyond that, we should also probably look at how we can retain those graduates when they are done from school, because that is one thing that is very important. Sometimes you have people who are even in their within the school system, while they're in medical school, they're already telling you, oh, I'm waiting to get my license so that I can japa, permit me to use that word. So when that is the situation, it presents a very serious situation. That means that that student who have been trained by the government, because it takes over 50,000, sometimes up to $200,000 to train a medical student in Nigeria. When you look at the investment by the government, it takes a lot. And then you have that student saying, oh, when I'm done. In fact, some of them will start thinking of how to write, PLAB for UK or USMLE for US and other countries. It presents a dire situation. So I feel that beyond just investing in medical education, which is a very laudable effort, thanks to the government, and we need to also look at what are those push factors, those factors that are pushing our graduate out of Nigeria. I know we cannot address all of them. No government, even in US, can address all of them. But can we limit them? Things like job satisfaction, things like, even for me, remuneration comes last. But jobs, because for every medical doctor, whether you're a medical doctor, whether you're a pharmacist or any healthcare professional, is not drawn to the profession because of money. Because if it's about money, I mean, people in petrochemical engineering, they make a lot of money compared to medical. So it's about that service to humanity, that resolve to save life, that passion to save life. But we need to have the right tool, the right environment to work. When we don't have this, naturally we'll look for where we can get it. I'm telling you this as a healthcare professional, So the government need to also look at that aspect too. Yes, we churn out doctors, we invest in education, churn out these doctors, but we need to keep them. Because if you invest in education and then get them out, and they already have the mindset that when I'm done, I'll leave, then, I mean, it's more like an exercise in futility. So while we invest in education, which is very laudable, let us also look at some of those push factors. Let's make sure that we have security because most of the medical professionals that are leaving the country, I've interacted with a number of them. They say, oh, Nigeria is, the security is a challenge. We know that it's everywhere in the world, but let's see how we can reduce it so that they can be confident in working in Nigeria. Let's look at their spouse employment. Let's look at education for their children, because these are really the factors that push them out. So if we address these push factors and at least reduce them to the barest minimum, then we can have them work in Nigeria. Despite the amount that is offered outside, they will be willing to work, because for a healthcare professional, it's not about the money, it's about service to humanity.
Yeah, service to humanity is what everybody would want to look at when you're talking about health delivery. Would you say that the initiatives that government have already started now is a step in the right direction? That is one part of the question. And the second part is, how would you have handled it in a situation like this, where we are having so many of our doctors leaving Nigeria and the situation at home is not improving? If you were given the opportunity to solve this problem, how would you handle it?
But I think it was about, correct me again. Okay, let me address the second question. For me, in this situation, what I would do is to, yes, first of all, I'll look at, looking at those who are around. There are some doctors, I must tell you, I know this very well. There are doctors who are in the country, but they are not being hired. They are just there roaming around the street. They don't have gainful employment. Can we lift the ban on employment? Let's have more doctors brought into the public sector. Because if you go to some hospital, some public hospital, you see that some doctors who were previously working there have left and they have not been replaced. So let us look around us first of all. Are there doctors who have graduated but have not been employed yet? Can we bring them into the system? Because
Dr. Ekanem,
one of the things...
Yeah, unfortunately, our time is up. Unfortunately. We need to, but your point has been made. 100 billion being put in place by government is a lot, and you have said it's a step in the right direction. Thank you, public health expert and national coordinator, Civil Society Network on Hepatitis, Dr. Nseabasi Ekanem, for your time. We must also thank you, social development advocate Olutubosun Oshifora, for your contribution as well. Though not a doctor, but you went ahead to talk to us about it. Thank you so much. And happy Workers' Day to you guys.
Happy Workers' Day.
Thank you. Thank you. All right, we'll take a break now. And when we return, we will be moving over for the FCT brief. Stay with us.